I'm Alison Cohen, and I'm an assistant professor at UCSF. I'm affiliated with the Philip R. Lee Institute for Health Policy Studies and the Department of Epidemiology and Biostatistics. I became an epidemiologist basically because I wanted to harness the power of numbers for good. So in particular, I do research that tries to be useful for working towards health equity, research that will answer community members' questions and policymakers' questions about how we can reduce inequities in health. And in particular, a lot of the work that I do is around how can we think expansively about what policies count as health policies. For example, thinking about the health implications of education policies and environmental policies, which I argue can also be health policies. So for example, in my 3E study, we're studying economic and educational determinants of cardiometabolic health in emerging adults at public Hispanic serving institutions of higher education in California. And Hispanic serving institutions of higher education refer to any institution where at least a quarter of undergrads identify as Latine. And so that's most of the UCs, most of the Cal States. And they've identified targeted structures and supports to try to support students from more marginalized backgrounds. And so our study is going to be seeking to answer questions like, are certain types of financial aid packages linked to better health outcomes? Or what educational supports that colleges provide can help support students' well-being? We know that this generation of emerging adults, so that's folks that are 18 to 24 years old, went through adolescence in the early years of the pandemic, had disrupted schooling. We also know that the consequences of the pandemic were borne disproportionately by those from more marginalized groups, many of whom are now at these Hispanic serving institutions of higher education. And so our study is going to be seeking to generate evidence on how some of these schools' education policies, economic policies, may also serve as health policies.